All right, good evening, everyone. Can you hear me okay? Yes, okay, great. Thank you for being here. I just was asked a question from our first lecture that I need to mention it before I forget. In our first lecture, Sister Act 1, we talked about the Sisters of the Holy Cross arriving in Utah in 1875 and all the wonderful things they did, including forming a relationship with Brigham Young, in particular, Sister Augusta. And they were known to enjoy some of the finest whiskey from the LDS distillery. So for the gentleman who asked me who the sister was, it was Sister Augusta, and she was a frequent visitor to Brigham Young to enjoy whiskey together, so much so that he did ask her to be one of his celestial wives. She politely declined, but they continued drinking whiskey on a regular basis. So I just had to say that for you. All right, some housekeeping items are in order as we get underway here. First of all, we'd like to thank Diane Kinspell and the Park City Museum for inviting Stu and I, or for hosting this lecture this evening. And of course, thank all of you for being here. We'd also like to thank Dalton Gackle for his assistance on putting together some of the slides and images that we used tonight. Just as a reminder, the Park City Historical Society and its three entities, the museum, Friends of Ski Mountain Mining, and the historic Glenwood Cemetery, we are a nonprofit and we depend upon our membership and donations. So for those of you who aren't members, please consider joining, and donations are always welcome. They're easy to do. In the upper right-hand corner of our web site, you'll see a donation and or membership button, so please consider that. Also, I'd like to thank Stu Stanek. The slide presentation you're going to see tonight is his wizardry. He's good at many, many things, but this is one of his specialities. So Stu, thank you very much for putting this together. A little bit about the format tonight. We're geared to run about 60 minutes, including a Q&A session. So I'm going to be the lead-off batter, and Stu is in the cleanup position. Some questions for the audience. Who in the audience was here in the 1970s and 1980s? Okay, great. It's a lot easier talking about things that were in the past where nobody's alive anymore. So tonight's lecture is obviously not going to be like that. So neither Stu nor myself were here in the 70s or 80s. So if we say something that's wrong, or you want to correct, or you want to add more color to it, please, in the Q&A session, we are not shy, since we have a lot of people in here who lived through the period we're going to be talking about. And thank you all for being here. Next. All right, some acknowledgments. We have our sources at the end of the lecture, but a lot of tonight's activities were based upon interviews we have done with people. First of all, we'd like to thank Andy Steer and Holy Cross Ministries for their tireless support of both our first lecture, which happened on November 12th last year, and this lecture. We'd like to thank Emmy Gardner, the CEO and president of Holy Cross Ministries, for her support as well. We'd like to thank Dr. Christian Reese for her generous time to meet with us. We'd also like to thank Dr. Thomas Schwenk for his time in sharing with us his memories of establishing community health care in Park City when it had none. We'd also like to thank Maggie Schneider for her generous support and time with us. And Cheryl Shosnick. I actually thought she was going to be here tonight, but I don't want to say she had a better offer, but she's in Chicago at an Elks convention. So for some reason, that might fall in the category of a better offer. And when she said she would be back on Friday, could we change the date of the lecture? I'm like, I don't think that's possible. So we did have a bunch of pictures from her kind of archives. of the clinic and the ambulance service, but I didn't know the names of the people. And so I didn't want to put anything up there that I couldn't definitively say something. And she was originally going to be here, but again, she had a better offer. And also acknowledge Sister Joan Stedman for her contributions to tonight's lecture. We do have a variety of distinguished guests that Stu will introduce at the end of the lecture, but we wanted to start off with acknowledging that a lot of this lecture is based upon our interviews with these folks. How many attended our first lecture? Okay, great. Because I may forget some of it, just a quick recap. During the Civil War, two of the greatest killers of Union troops was disease and infection. And it was rampant in Army hospitals, military hospitals. In fact, more people were dying through disease and infection than were being killed by Confederate troops. So General Grant, in desperation, reached out to Sisters of the Holy Cross and asked them would they consider being Army nurses. And they said yes, but with certain stipulations. That any hospital they worked at had to adhere to their strict hygienic protocols, no exceptions allowed. And they would treat anybody who was admitted to the hospital, anybody, no. And General Grant agreed to their requirements. And the first hospital that we were assigned to was a US Navy hospital, a floating ship in Cairo, Illinois. Their impact on the conditions there was immediate. Some would say divine intervention. And over the course of the Civil War, Sisters of the Holy Cross, the nurses would be deployed to 15 different military hospitals, all with the same results. When the war ended, their reputation had spread far and wide. Next. This is a flyer from a period of time commemorating their outstanding performance during the Civil War and credited with saving many, many lives. For those who experienced their care, they were referred to as angels of mercy. So the order remains to this day great emphasis on education, medical care, and always pushing the boundaries of what's right for the patients. And nothing has changed. Next. All right, in the first lecture, we mentioned about the Sisters of the Holy Cross arriving in the Utah Territory in 1875. By 1880, they had arrived in Park City. And they said about the same strategy they did in the Valley. They needed to build schools, they needed to build churches, and they needed to build hospitals. And for that, you need money, and you have to do fundraising. So they wasted no time going to where the money was, the mines, the workers. Of the miners in Park City in the 1880s, and were Irish Catholic immigrants, so that was one of their target audiences. By 1881, they had raised enough money to build the first St. Mary's Church and School. Unfortunately, that school and church burned to the ground 3 years later. It was made out of wood. They rebuilt it the next year out of stone. They weren't fooling around with wood anymore. And in 1887, the St. Mary's that we know and love, one of the crown jewels of Park City, remains today. And building it out of stone proved very fortuitous during the Great Fire of 1889, when 70% of Park City was incinerated. And it became a refuge for people who had lost their homes. It became a triage center for those people that were injured, and it also was what we would call today a food bank. So again, providing a vital service to the community. Community healthcare personified. Before 1904, if you had a serious illness or a serious injury, you were kind of in a tough way. There was no local plausible medical service for extreme conditions. You would have to be transported to Salt Lake City. It could take up to 24 hours for you to get down there. And during that period of time, things probably didn't get better. They only got worse. So in 1904, or leading up to that, the citizens of Park City, the mining organizations and fraternal organizations all got together and created what you would call an HMO today. And that was Miners Hospital, which opened in 1904. And this is a picture of Miners Hospital from kind of its heyday. One interesting little side note, Miners Hospital in the early 1920s ran into some management issues, and there was controversy, and it closed down for a brief period of time. Holy Cross Hospital attempted to buy Miners Hospital in 1922, and they bid $5,000. However, they were outbid by a Mrs. Margaret Clark from Heber City. Nobody knows where Mrs. Clark got the money from, but she had a well-established reputation for being a self-taught nurse and medical practitioner, and she ran a clinic out of her home in Heber City. So she would come to own Miners Hospital and run it for an extended period of time. Okay. Beginning in the 1930s with the Great Depression, Park City began a slow and steady decline to near oblivion. And along with that decline, so too did community health care decline. And yes, in 1963, the economy began to try to diversify with the opening of Treasure Mountains. However, that transition to an economy based upon a semi-renewable resource, snow, would take a long period of time. And by the 1970s, the once vital Miners Hospital, you can see from this picture, was derelict. And the one wing had been shorn off, and this is before it was resurrected and moved over to City Park. So it was a period of tough times for Park City in the 1970s, especially for local community health care. Next. However, Sisters to the rescue. Sisters of the Holy Cross continued to serve Park City through their church and school in town. And they saw a need to serve an underserved community. And that underserved community was Park City. And they made a multi-year commitment to create a community health care operation in Park City. And there were two parts of that. Part number one was to operate the local ambulance corps, which we'll get to in a second, beginning in 1980. And in our first lecture, if you remember, Cheryl standing up at the end, and something I didn't know, but for those of you who did, reminding us that Holy Cross Hospital operated the ambulance service in Park City from 1980 to 1994. And with that, she also mentioned that part of the original plan was to build a hospital in Kimball Junction on 8 acres of land that had been donated for that activity. So this is a picture of the facility that used to be their hospital in Salt Lake City. But again, there's a need in the community. We're going to step up. And part of that stepping up to it is, next. As I mentioned, they took over the ambulance corps. Part of that was they had to buy a new ambulance. And a fully loaded ambulance in 1980 cost $30,000. And though it may be hard for some of us, raise my hand, to comprehend that Park City couldn't afford a new hospital, the reality is they couldn't. So the Sisters of the Holy Cross stepped up, bought the hospital. They agreed to pay the EMT workers, which heretofore had been all volunteer, and they also made a commitment to establish a family clinic in town. And that clinic, the first full-time doctor and physician's assistant, a Dr. Thomas Schwenk and a Mike Anderson, were hired in 1978, and they operated the clinic out of a trailer. That trailer would be moved into the Skaggs market, also known locally as Alpha Beta. And Mr. Skaggs said, you can have this portion of it for your clinic, and I'm going to charge you $1 a year. So they were, again, making this commitment in the local community because we needed community health care. This is an AI rendering of what the hospital could have been in Kimball Junction. The budget for it was $5 million, and it was their intention to, over a period of time in the 1980s, build a hospital in Kimball Junction. However, things change. And again, remembering the mission of the Sisters of the Holy Cross, we serve those in need. And the more needy you are, we're going to serve you. And in many cases, they were the only one providing service over their history. And in a moment, I'm going to be turning it over to Stu, because he's going to be doing the heavy lifting. But beginning in June of 1980, the CDC reported 5 cases of a strange form of pneumonia that had been discovered in San Francisco. Before the end of the year, all 5 patients were dead. And this, what began as a trickle, became a torrent, and the gathering storm became a hurricane. And the resources of Holy Cross Hospital, the resources of the Sisters of the Holy Cross were being diverted to focusing on this crisis that nobody wanted to deal with. And we're not going to push the button here because we don't have that capability. And Tom Brokaur's voice sounds a lot better than mine, so I'm sure you'd rather hear it. But he's basically saying a new type of cancer has been discovered. And it primarily is affecting, I think, what could be called the alternative lifestyle community. And it's very, very serious. And your life expectancy, if you had this type of cancer, was 18 months. No treatment, no cure. There remains no cure today. However, there are treatments that can prolong. Next. And what was this virus? You can read it. I have trouble pronouncing it. I attribute that to my New Jersey speech impediment. But HIV was a virus that was particularly cruel. You could get it, and the latency period in your body could be anywhere from 8 to 10 years. So you wouldn't even know you had it. But by the time it became evident, it had morphed into its most dangerous stage, AIDS. And again, your life expectancy before the mid-1990s was less than 18 months, so, and no treatment. And over the period of time from 1981 to 1994, as an example of the extraordinary organization that the Sisters of the Holy Cross and Holy Cross Hospital were, and the physicians and other medical personnel who worked there, they would treat 90% of all AIDS patients in the state of Utah. They would become an epicenter for knowledge transfer for other hospitals in the mountain states. But Holy Cross alone in the state of Utah stepped up to the plate when nobody else would. By September of 1982, the AIDS crisis was sufficient enough to be front page news on Time magazine. And it was an epidemic, and a cruel and violent epidemic. And with that, I'm going to turn it over to my colleague, Stu Stanek. And thank you for my introductory part.
Thank you, David. Now we go from a New Jersey speech impediment to a Wisconsin speech impediment. I always try to see if I can find a way to make people laugh in a thing. This is a pretty difficult thing to do that in. I've maybe got one line that might render something, but the time period we're talking about is basically 1981 to 1994. It involves heavily the Sisters of the Holy Cross and some medical people who did unbelievable work in Salt Lake City. One day, a few weeks ago, Andy Sears said, "Hey, I've got a meeting with Dr. Kristen Rees on the left and Maggie Snyder on the right. Do you think you and David could make it?" And I was out the door in about 4 minutes because I've been researching this a lot, and this is the royalty, some real heroes in this story. They let us into their home. They filled in a lot of parts of the story. It's amazing how little ChatGPT really knows or Google really knows, and you have to kind of drill down to get some of the facts in the story. They were gracious hosts, marvelous people, and we were honored to be there. And I'm going to start with Dr. Rees. She grew up in Pennsylvania. She studied at Drexel University. She completed training in internal medicine and infectious diseases. She left Philadelphia for the wonderful and sexy Wounded Knee, South Dakota, but she worked in the Indian Health Service there on the Ogallala Sioux Pine Ridge Reservation. This was a great place for her to be trained in infectious diseases. After a few years there, she moved to Vermilion, South Dakota, where she was a member of the National Health Services Corps. She then moved to Salt Lake City, so this is where we can begin our story. She was there right from the beginning. She arrived on June 5th, 1981. We did a lecture last week. It was in the 1800s, so I might do that a few times. That was the very day the Centers for Disease Control described the illness that came to be known as HIV. There was very little known about it at the time. There was a few press things. We all who were alive at the time were very confused, but it was becoming a monumental health crisis, and it really dovetailed into her infectious disease background. This article was published December 10th, 1981. I heard reference of her finding out about it from the New England Journal of Medicine. I looked for a lot of headlines. I don't understand anything that this says, but I think somebody like Dr. Rees would understand. Obviously, it piqued her curiosity. It set her career in probably a different path than it would have gone in, I think it's safe to say. I was trying to find out how they came to be involved with the sisters, and I couldn't find that anywhere, and this meeting with them really helped us figure out. Dr. Rees started working for FHP in Salt Lake City, which was a healthcare provider. She met a guy named Dr. Peter Hachisaki, and he's a fellow from the University of Washington at the University of Utah. Now, I didn't really know, I wanted to find out what fellow in this context meant. It's not bro, it's not dude. It's a guy who's studying beyond his residency to get extra training. He told her that he had met a couple of patients who were likely HIV patients, and he needed to get them admitted. FHP at the time where she worked had admitting rights to Holy Cross Hospital, and he had been moonlighting there. He just couldn't admit patients. She agreed to help, brought these patients in. He took her over to Holy Cross. She was touring around the hospital, and before she knew it, she was setting up her practice there. She discovered also that I think her values personally were very much aligned with the sisters and Holy Cross, and that became what would be ultimately a really great team. Another key player in our story tonight is Sister Linda Bellamore. She was with the Holy Cross. She was a sister of the Holy Cross. She was, I think, stationed or assigned to Richfield, Utah, and they asked her to come back to Salt Lake City. And they said, "We want you to come in and care for aging patients like you've been doing." She had a lot of training in this. But 2 weeks before she came back, they said, "We want you to do something similar, but there's an entirely different group of people that we want to take care of. There's this disease called AIDS, and some of these people really need our care. So they said, are you willing to do this? And she said, yeah, of course I am. I'm in for it. I don't know much about it other than what I've read in the newspaper, and you'll tell me what I need to know, right? They said, yeah, come on in. She was a trained educator and nurse, and she went on to develop a comprehensive care program, which Holy Cross called continued care. It was basically for patients who were in the HIV ward at Holy Cross. It tried to address some really important needs in that community: housing, food, education, emotional and medical support, crisis intervention, and of course, funeral planning. And that began, she said, the most transformative ministry of my entire life as a sister. Talk about tackling an issue head on. Sister Bernie Mulick was at the hospital at the time, and she recalled that doctors had warned people at Holy Cross not to take in AIDS patients. They said, this is just too controversial and you don't want to do that. And initially the management at Holy Cross didn't want to admit these patients into the hospital, but the sisters, of course, objected. The staff didn't want people there because they thought it would close the hospital down, and that was very worrisome because, again, there was so little that was known about this. Sister Bernie said that it would be irresponsible not to treat these people. These men and women were so sick at the time, and nobody cared for them, and they were like the lepers of the world. We need to take care of them. Okay, to say that treating AIDS was not a lucrative profession, that would be an understatement. Patients who were severely ill lost their jobs. People who lost their jobs lost their insurance. People who weren't working, didn't have insurance, and had medical bills were either poor or they were going to head toward being poor. So the sisters recognized that Dr. Rees needed to make a living working at the hospital, so they gave her jobs at the hospital, one of which was running the first ethics committee in any Utah hospital in the whole state of Utah. She did these jobs. She made some extra money. Her practice survived. And because she wasn't all that busy, she decided to do some work at nursing homes on nights and weekends also to supplant her income. She had a line for us that, for whatever reason, it just sticks with me. She went to ethics training and was at classes conducted by Jesuits. So she was looking back on it, reflecting. She said, I was reared by Quakers and trained by Jesuits. Dr. Rees was going it alone, and she was treating dozens of patients. And she told us I was drowning. I think she was way overloaded with cases. So Maggie Snyder was a head nurse at the diabetes ward there. And she stepped down from being a head nurse to volunteer at the HIV part of the clinic. She was interested in it and wanted to help. Sister Joan Stedman, and we'll talk about her in a minute, said we need to send her to physician's assistant school, let her go there for that 18-month program. She can come back in and be a right-hand person for Dr. Rees. And Holy Cross stepped up and paid for half of Maggie's tuition to do the schooling. Maggie said that when she got out of school, she was sort of thinking about a 9-to-5 job. And she said it didn't really turn out that way. The hours were long, the work was arduous, and they indeed made some house calls as well. Maggie and Dr. Rees became the team, the frontline treatment and study of AIDS in Utah. They were the only medical professionals in the community treating AIDS patients. They were also routinely consulted by doctors from around the West. They were kind of regionally famous, if you will. And here's something that underscores that. From 1981 through 94, they treated 90% of all AIDS patients in Utah. Phenomenal. Like I said, there's not a lot of fun news here, but we have to talk about this. Families wouldn't acknowledge if somebody in their family had AIDS. They would say, no, he's not sick, or she's not sick, or it's pneumonia, so don't worry about it. Patients were ostracized by their families, by their communities, and by their churches. Sick patients would be turned away from hospitals. They would be evicted from waiting rooms. They had nowhere to go, and there was only one place they could turn to, and it was the doctors at Holy Cross, and it was the sisters at Holy Cross who took them in. Obviously, patients could feel very dejected. When you really come to grips with what this was, you know that you don't have too far to go in life. The consoling and the counseling that the sisters gave were a big part of this. There was a need too for secrecy. A lot of people that wanted to be there didn't want people to know. People would come to the clinic at the hospital and wait till the end of the day or in the early evening and come in the side door because they didn't want to be seen there, because it was well known that Holy Cross was admitting AIDS patients. They came from the upper echelons of society. They came from all aspects of society, but the doctors and the sisters at Holy Cross decided they wanted to honor the request for secrecy. Just a few days ago, we had a chance to Zoom. This is a terrible photograph of Sister Joan Stedman from my computer, but I wanted to show her in present day. She came into the hospital in 1988. She spent a year kind of wandering around and seeing what was going on in the HIV ward. After a period of time, she became the administrator, and all the people that worked there reported to her. And she had some interesting points, one of which was that there was a lot of fear among the people that were at the hospital. I think we can all understand why. There was so much that was unknown about it. Didn't know how it spread, didn't know how dangerous it was, didn't really know how to treat it. But her key remembrance of this time there was that they strived to respect the dignity of those they cared for. The fear that was present in the hospital made it really difficult to take care of AIDS patients. Maggie Snyder remembered nurses saying they could not go into an AIDS patient's room because her husband felt like he might bring it home to the family and spread the disease into their household. There were plenty of precautions they had to make before they went into rooms. They knew what they had to do to prevent them from getting illness, but it was still, I think, honestly, had to be a nerve-wracking thing that they went through. As a result, everybody at the hospital that worked in the HIV ward did it voluntarily. A lot of people stepped up, and it's certainly a heartwarming story. This unit was called Med 3. Sister Bellamore did a lot of her care, and as did other sisters, outside of the hospital. Patients were driven to appointments, they were driven on errands, they spent time in the car talking to the sisters, and they knew that they needed help, and they were the only ones that could provide that help. Here, Sister Linda is seen knocking on a door with food and medicines, taking it to a patient's home. She often would be invited into the house, and the first thing she would say is, "Can I have a glass of water?" That would allow her to go and look at all the cabinets in the kitchen and see whether or not there was food there. And so if there was no food, she knew what she had to do the next time she would visit there. And the place would range from fancy houses on the benches in Salt Lake. And she said, I even went so far as I found a cardboard box at what she called a hobo camp in Salt Lake and found somebody there that she needed to help out. Really a touching story. She said, these are all young people who have never been sick. They're not only sick, but they're dying, and they need so much of our help. Fulfilling dying wishes was part of the dignities offered by the sisters. Some of them were things like a trip to Epcot Center, sitting by a mountain stream, or going to a mountain retreat. This was a thing that the sisters had access to, and they would take some of these people up there at the end of their life. And there was funeral planning. There were some very unique requests among these funeral plans. One man had been a DJ at a nightclub in Salt Lake City for a period of time, and he said, I know you're a nun, honey, but I would really like to have my funeral in the bar where I worked all those years. Sister Bellamore thought, well, that's unusual, but if that's what you want, that's what we're going to do for you, and she had that funeral in that bar. Another another patient who was planning the funeral said there was a chapel at the hospital, and you go to pray at the hospital for the victims who are at the hospital. He said, I'd want my funeral in there. And they said, well, that's a bit unusual because you're leaving, but you're coming back deceased. So that's okay, though. We can do that. They did whatever they could to give this feeling of somebody's got your back, somebody cares about you at the end of their life. We really wondered, you hear about these people being ostracized. And we wondered, there had to be somebody that changed their mind on this, like they saw what it was, and let's go back and help. And Joan Stedman said, I have a great story for you. There was a Mormon ward downtown. When this patient was diagnosed, he was kicked out of his church. And there were a few members of the church, and she called them primarily older people who knew him well, lived nearby, and they said, this just isn't right. We need to go see this guy and take care of him. She said that they made sure he had everything he needed, and these people were guardian angels to this man. Now, I bet there's a lot of stories. We couldn't find any more necessarily, but I thought that was a touching one, and it really speaks to how people can change their mind when they're confronted with something like this. And this ties to a quote that really stuck to me too when we talked to Sister Joan. She said, when you know the person and see how they're suffering, all else goes away. I think those are words to live by right there. There was a lot of difficult things they did, and this one is probably the worst. There was a man literally dying, and he had hours to live, and he said, just call my mom, please. He said, if I could see her one more time, that would be great. She made the phone call, and the visit never came. He said, she doesn't even have to come in. If I could just see her through the doorway, just one more time, please. That was some of what they had to deal with. There were people that thought that this was certain religious beliefs felt like these people were sinners, and so this is God's punishment. And she would make other calls, and she'd be asked to make more calls. She would get things like, don't ever call here again. He made his bed, he can die in it. That's his just desserts. Let him go. And so she had to do this over and over again. I can't imagine how difficult it was. This is how deep they went for care at Holy Cross Hospital. She said, in cases like this, all I can do is be a presence for them, which I think is, very truthful and honorable. So in addition to being a presence, they were often involved with end-of-life planning and funeral plans. Given that patients were usually cast off by their families, it was just another thing the sisters would do for them. When patients died, the way to handle a funeral was not very straightforward. With family members looking the other way, they had to figure out a strategy, so to speak. Sister Linda took the lead on this, and she found a mortuary in Salt Lake City that would do sort of discount cremations, or they would get a deal on cremations. They would gather up the money at the hospital, they would pay for the cremation, and Sister Linda would take care of the ashes. And there was a place in the Catholic cemetery where if nobody wanted these remains, that they could inter these ashes there on behalf of the deceased. Maggie Snyder said that, I want to quote this one. She said that all these people were local people, and it's quite likely that they weren't Catholic, or a high percentage of them weren't Catholic. And I don't know how it rests with them, but they're in this interment in a Catholic cemetery, and I think that's a great thing that the sisters did. On a very somber note, when we spoke to Dr. Rees and Maggie Snyder, they told us that they had started counting patients that had died, and they stopped counting at 500. I missed Sundance already, and that maybe this is one of the reasons why. This documentary was released at Sundance in 2018, And it told this story in depth probably better than David and I could ever tell it. But the producers had interviews with medical professionals, politicians, patients, and people who had family members that were afflicted. It was a lot of content from the 1980s, so there's a lot of interviews from back in the day. And there's extensive interviews with Dr. Rees and Maggie Snyder. It showed how the disease could tear the community apart, tear families apart, and it did a masterful job of depicting the love and care that was happening at Holy Cross Hospital. I really recommend you see it. Have a box of tissue with you too when you do that. Quiet Heroes producer-director Amanda Stoddard had some interesting perspectives. I read an interview that she gave a little while ago, and she said, there are no places like Holy Cross Hospital now, not in Salt Lake. There's nowhere that anyone can go and get treatment and have people care for them out of the goodness of their hearts. Those nuns were really, really special. And while the film Quiet Heroes is an awful lot about Dr. Rees and Maggie Snyder, those people there at that hospital really stood up. So this picture was taken not too long or during the time that it was released. And this is the A-team. These are the people who were national and regional phenomenons. This is the Sisters of the Holy Cross and the doctors. On the left, Sister Suzanne Brennan. Now, one thing I want to say about this photograph, I wasn't there, but when the photographer said, well, the tall ones stand on the left and everybody fill in, they did it just absolutely perfectly. Sister Suzanne Brennan, Sister Joan Marie, who we talked to, Maggie Snyder, Linda Belmore, Sister Linda Belmore, Dr. Rees, and Sister Bernadette Mulick. This is the A-team, the superstars, somebody that did an amazing job in Salt Lake City, and it's really great that this movie highlighted some of what was done there. A lot of the care that was administered at the hospital went unpaid. Patients who were ill often couldn't afford their care, and they were financially destitute in some respects. Dr. Rees continued to treat patients so long as they could make a $5 a month payment on their bill. Many times at Christmas, the bill was written off as a Christmas present, a very heartwarming, obviously, gesture. On the hospital side, fees for a lot of the treatment that went on at the hospital went unpaid as well. So there was a lot of care, charity, compassion involved on both sides of this, the medical staff and the Holy Cross people. However, nationally, there was some hope on the horizon. And it took a very sad story to bring it to light. Ryan White was an Indiana teenager, and in 1983, got a blood transfusion because he was a hemophiliac. He contacted AIDS, and I think initially, if I remember what I read, they gave him 6 months to live. And he became an advocate for AIDS research and AIDS awareness, and campaigned very hard. And sadly, he was kicked out of high school because the parents in the town objected to him coming to school. And so it's a double whammy. He's ostracized from his school, from his friends. I can't imagine the grief that he went through, but he made a huge impact with the time that he had left. And it's something that is extremely rare. There was an actual bipartisan bill passed in Congress, the Ryan White Act. It has a longer name, but it was because of Ryan White. It created a federally financial program that would help people who were poor, underinsured, not insured, and anybody that really needed the financial help. It passed the Senate with a vote of 95-4. Are we ever going to see that again? The act has been renewed several times. It did sunset, I think, around 2013, but Congress every year had kept renewing the funding. And the act is credited with saving hundreds of thousands of lives. It raised awareness, it provided money, and obviously after a while there was treatment and drugs that would really help people with the condition. Sadly, today, I read a few days ago, it's proposed in the House to peel away $250 million of this funding from 2026. not in the future, but right now. So we can only hope that those people come to their senses. Here's a little data, and I want to do a disclaimer here. Andy and I and David got together a couple days ago. We started Googling, ChatGPTing, whatever, AIDS statistics, and we couldn't find anything that corroborated each other. So this is supposed to be from the CDC. It shows, I think the dramatic upswing that it shows is accurate. 317 patients in 1981, all the way to almost 500,000 by 1994. That's how serious this was, and 30 million people worldwide died of AIDS during the same time period. So this is something that continues to be work that we need to do. David and I, as he said, covered the Sisters of the Holy Cross for another lecture, and the reason we're doing this separately is this is such a big story, we couldn't roll that into the last one and do it justice. The sisters came in 1875, and in about 6 months, they built a girls' school, they built a boys' school, and they built a hospital, all rapid fire in a place they had never been before. Amazing, amazing, amazing. But in 1994, the decision was made to sell the hospital. The hospital's AIDS care maybe played some sort of role because there was controversy, stigma, and staff anxiety. But there's no direct evidence that that is the exact reason why it was sold. Maybe it had an impact on business for a certain time, but they sold it for other reasons. The inspiration for this came from a financial decision. At the time, healthcare was being gobbled up by big companies. They would have to spend a lot of money on infrastructure and systems to keep it going. So they made the decision to sell it, but they acknowledged that their mission needed to continue on, but it didn't have to do so through the halls of a brick and mortar hospital. They could do it in other ways. And what they have done now in Utah, and they have continued on for a long time, the Holy Cross Ministries continues to with the mission of caring for marginalized people all over the state of Utah. It's a great organization, and one of the key guys is here in the crowd that we'll talk to a little bit later. To say that there is mutual respect between these people would be an understatement. When we talked to Joan, I thought this was, I'm getting near the end here, but when we talked to Joan, Sister Joan, she had nothing but praise to gush on Dr. Rees and Maggie Snyder. And she said, both of those women reflect the values of compassion, wisdom, respecting human dignity, care for the poor, and inclusion. I mean, who they are and our values and concerns really came together during this time period. And then she added, they were courageous, generous, and humble. In 1994, when the hospital was sold, Dr. Rees and Maggie moved to the U. If I understand it correctly, she took about 500 patients with her, and the HIV clinic that she set up at the U of U is still functioning today. When you study the AIDS epidemic in Utah, you'll find that the medical community as a whole, we're very grateful to and thank Dr. Rees and Maggie Snyder. But Dr. Rees had one other thing to say when we met her, and I think this is super poignant. And she also went on to say, to give credit where credit is due. Couldn't have done it without the sisters. Okay, I wanted to tell you the story of Michael. He was very memorable to Sister Belmore. She was helping him plan his funeral. And in the planning stage, he said, all my life I've wanted to go to the Epcot Center. I would give anything to go to the Epcot Center. In fact, he told her, I'll be 2 days late for my funeral because I'm going to go down there as soon as I die. So as it turns out, Sister Belmore was asked to give a homily at a Catholic Mass in Orlando in front of 400 hospital executives who had gathered there. She was going to do this homily, and she said, I needed to be creative. and I figured out a way to get him to Orlando, and ultimately I took him to Epcot Center. But I said, if I'm going to do this for you, you got to speak to these people. And he said, okay, put me in, coach. The story that she told about this in video that I got from Andy at Holy Cross is about 18 minutes long, and I wish I had time to show you the whole thing. It's absolutely amazing. But this is an excerpt from an interview that Emmy Gardner did with her. This was about 2 years before she passed. I wanted to play this because, oh, it's so good. You're going to like this. It really, I think it speaks to the core mission of Holy Cross and the incredible efforts they expended on behalf of these patients. Now, it kind of starts like abruptly, so I want to tell you where we are. She's gotten done speaking. She goes back to where he's sitting and helps him stand up from his chair and gets him up to the stage. So it's right as she walks up to him, and we're going to hear her talk about Michael.
Right before he even went up the stairs, I said, Michael, do you know what you're going to say? He said, I have no idea what I'm going to say.
Oh, wow.
So,
He's going to speak from the heart. Exactly.
Talk about trust. Yeah. So anyway, I had said my piece, and I helped him up. Mm-hmm. And he said who he was, and he said, you probably don't know that I have AIDS. Well, you could see the eyes of these corporate executives from all over the country. What do you mean? We've got a man here with AIDS standing in front. I could just hear what was going on. And he said, yeah, I have AIDS and I'm dying. And I live in Salt Lake City. And I've been taken care of by these sisters in this hospital. He said, now my mother was scared to death when she found out I was going to be in a Catholic hospital. Because she thought, sure, the devil would get a hold of me. Mm-hmm. But he said, I told my mom, listen, you come see these nunnies that run around here and take care of all of us. He said, this is where God is. This is where God is. I thought, talk about a profound affirmation of Catholic healthcare and Holy Cross healthcare. But anyway, he went on and shared a little bit about how the kind of care he got. And I'll never forget his closing line, and he only talked maybe 2 minutes. He looked at them and he took his finger and he said, I want to say something to all of you folks out there, and I know you're all bigwigs and I'm a little wig. I want to tell you something. If the hospitals that you're running give anywhere near the kind of care that I, as an outcast, somebody dying of AIDS, get at Holy Cross Hospital in Salt Lake City, if you get anywhere near that, you have nothing to worry about evaluating the kind of care those hospitals are giving. And he sat down.
Wow. Yeah, profound message.
Profound. Mm-hmm. I think for me it exemplifies that we're here to meet the needs of whoever comes into our lives. That's what our mission is, our charism. Sometimes it takes creativity, sometimes it takes openness, confronting maybe our own biases or beliefs. It comes using every ounce of who we are in whatever the circumstances are in the unpredictability, and we have to take risk.
Exactly.
But that's the call, who we are as Sisters of the Holy Cross.
And that's what we would call a Catholic nun's mic drop, right there. Not much I can say. I think that really speaks for itself. With all the research we did on this very fascinating story, it seems as though the sisters at the hospital, Dr. Rees and Maggie Snyder, were bound by one guiding principle: do what is right. Now, I just learned about this a few days ago. This memento that Sister Bellamore is holding was stitched by Dr. Rees and given to her from Maggie and Dr. Rees. And I think she was happy to receive that, it's fair to say. Now, David said that we have some distinguished guests here, and I'd like you to acknowledge and meet Dr. Kristen Rees and Maggie Snyder. So when they came in, I thought, holy crap, this scares the heck out of me. And I said to David, I'll switch halves with you. Would you please? Could we just trade? There's too much pressure here. But that's it. We've got time for questions, corrections. And I want to extend the same gratitude that David did for all of you coming, and to Diane for making this available. And sometimes you come across stories you just get sunk right into, and this was one of them. And Dr. Rees and Maggie said that after the documentary, I think they were being polite, there were some inaccuracies. I certainly hope I cut way back on any inaccuracies here, but so it's a good story, and we did our best to tell it in a factual manner. Dave, anything from you?
The only thing I'd like to say, first of all, great presentation still, wonderful. And Dr. Rees and Maggie, we can't thank you enough for making the trek from Salt Lake City up here tonight, where it's an honor and privilege to have you join us. Also like to acknowledge Dr. Schwenk, who was the first person hired by Holy Cross Hospital in July of 1978 to open a community health care clinic here. You operated out of a trailer before you moved into Skaggs Alpha Beta Market, and also he was assisted by Mark Anderson, who was a PA. So Dr. Schwenk was kind of the vanguard of the reestablishment of community health care. And where the sisters never got to build their hospital in Park City, I think we can all, their vision was ultimately fulfilled by the wonderful medical facilities that we have in our community. So though, like I said, they didn't get to build their hospital, we have one now. So kind of this continuing effort. For me, this project's been great to work on with Stu, and Andy Shear has been terrific in the support of Holy Cross Ministries. And again, for Dr. Rees and Maggie Schneider, we can never thank you enough for your time and generosity, and also making great coffee. So anyway, any questions, please ask. We have a lot of people here who lived in Park City in the 70s and 80s, and Dr. Schwenk was the vanguard for local community care, reestablishment of it. And of course, we have Dr. Rees and Maggie Schneider and Andy Shear. So any questions, go for it. Or no questions.
Yes.
I want to thank you for the presentation and for telling us about the benevolency of Dr. Rees and his sisters. I was having a flashback during this because I trained at UC San Diego in the late 1970s and early 80s, and I took care of the first AIDS patient in San Diego. And we had readmissions, and of course these were all young people in the prime of their life. And one after the other, infections and malignancies, and there were some poignant times on the oncology ward. A 30-year-old had a wedding because he had less than 6 months to live. He had non-Hodgkin's lymphoma, and the medical personnel, not everybody had that benevolency and do what's right. When I was a fellow at UC Irvine, I remember the other 5 fellows came together, and they looked at me and said, "Larry, you're single, you don't have any dependents, we all have children and families, you should be the AIDS designated fellow because you have the least to lose." And so I just have to give my hat off to, I can't imagine what it would have been like to serve the AIDS population in Utah. And Southern California was medically very populated, and so it really wasn't that big a struggle. But I really have to congratulate you on what was just an incredible experience in serving the population of Utah.
Thank you for that.
Thank you.
Did you have one?
I'm not clear. If you were diagnosed with AIDS.
Okay, wait, can we just talk into the mic so that the recording picks it up? Okay, thank you.
I'm not clear. If you were diagnosed with AIDS in those years, the hospitals turned you away? Other health clinics turned you away?
That's
Or
true.
didn't have the same compassion that Holy Cross showed?
Turn them away. Turn them away.
Anyway, I was just I was a social worker in the '80s, and I worked in South Salt Lake in that area, and I had a caseload of a lot of prostitutes and kids in foster care, and some of the prostitutes had AIDS, and so the reaction and the prejudice that was going around the community, if there was any connection, like I would get a wrath from the foster parents that the mother of the child had AIDS. So there was a lot of issues centered around that prejudice that was very, very difficult to deal with at the time. So
That's a great comment. It was somewhat more difficult to get the Sisters of the Holy Cross to talk about sex workers, but clearly that was a community that was affected, intravenous drug users. It was very broad across the community, and that was one of the key parts of it.
I worked at one of the LA County hospitals in the early 80s as an occupational therapist. And it'll make me cry, but we had floors of sick patients. And what was so humbling is you would have to gown and scrub and mask and just put on so many double gown just to go in to see somebody, and they never had anybody touch them, to get them a hug or anything. And I'm so grateful that they found a way to help them.
Megan, I'm glad you brought that up because, and I slipped, I didn't say this, but because it was a death sentence, and because of what you said, many of the sisters said the best thing we could do was give them a hug. They needed that human connection desperately, and so that was something they were very proud of, that they were doing that.
Thank you, guys. Appreciate your.
One more question.
I really didn't have a question, Mr. Cohen. I'm Larry's wife. And I wanted to share, I was a pediatrician back in the 1980s, and I was assigned to the hematology and oncology ward very frequently. And I ran into, on the very first day of my residency, a little boy named Larry, who was a hemophiliac who had HIV. And it was shocking to me how many residents and even nurses did not want to care for him. He turned out to be my favorite patient of all time. And 2 years later, I met this guy who came up to me and said, "Hi, my name is Larry."
Oh. When did he finally tell you his name was George? All right, thank you, everybody.
Yeah, thank you all
for
very
taking
much.
time.
Yeah.
Thank you.